Hello everyone, I am Hannah Krista Joy E. Bacus and today I will be performing the hand washing technique. So, hand washing is the most effective way to prevent the spread of microorganisms. So, one of its purpose is to reduce the risk of contamination and also to reduce the risk of transmission of the microorganisms to the patients. So, before starting the procedure, you have to make sure that the equipments to be used are complete, like an easy to reach sink with warm water, a liquid or bar soap, a tissue or a paper towel, and also a trash can or trash bag. So first, you have to stand in front of the sink and do not allow your uniform to touch the sink during the washing procedure. This is because the sink is considered as a contaminated area and our uniform should never come into contact with the sink to prevent the transfer of microorganisms into our uniforms. So next, we have to remove all jewelries such as wristwatches and rings because removal of jewelry facilitates proper cleansing. So next is to turn on the water and adjust the force. So we have to control the pressure of the water so that the water will not splash on the contaminated sink that will also contaminate our uniform. Next is to wet the hands from the wrist area, pointing fingers toward the bottom of the sink so the water should flow from the cleaner area toward the more contaminated area. Now you have to inspect the condition of the cuticles of the hands and forearms for abrasions, cuts, or open lesions because open cuts of wounds can harbor high concentrations of microorganisms. Next is to use the bar or liquid soap and lather hands thoroughly by rubbing palm to palm and in circular motion. Now interlace your fingers and rub your palm using the back of the hand for at least 5 times. Next is to rub the palm to palm with fingers interlaced. Now rub the back of fingers to opposing palms with fingers interlocked. Now rub each thumb clasp in opposite hand using rotational movement. Now do the rotational rubbing, so backwards and forwards with clasped fingers of right hand to left palm and vice versa. Now next, rub each wrist with opposite hands. So next is to rinse our hand thoroughly and inspect for remaining dirt or soap. Running water rinses organisms and dirt into the sink. So now we are going to dry our hands using tissue. So we have to dry our hands in order to prevent the skin from chapping. Okay, throw away the tissues that you use in drying your hands. Now, you have to use another clean tissue to turn off the faucet. So this prevents from picking up microorganisms from the faucet handles. And then discard properly the used tissue. Okay, that is all about the proper hand washing technique. So always remember that we have to follow the 5 moments of hand hygiene, and that is first, before touching a patient, second, before a procedure, third, after a procedure or body fluid exposure risk, fourth, after touching a patient, and lastly, after touching patient surroundings. So that is all. Thank you.